moving on, questions from members of the public. The first question is from Dr. Self. Dr. Self, would you like to read? Yeah, thank you. And if you could read your question, please, so that we may all be aware of it. Some of us have got it written down, but some may not.
How is the council ensuring it has an independent support service for parents of children with special educational needs and disabilities, as is required by law under the Children and Families Act? Independent services finish in April this year. New funding has been made available from the DFE from December 2017 with an invitation to bid nationally for contracts. How does the council's budget ensure provision for this very vital service?
I call on the Cabinet Member for Young People and Children's Wellbeing to respond.
Thank you, Chairman, and I would like to thank Dr. Self for her very interesting question. The government is currently tendering for a single provider to deliver a national contract that will ensure the following. Children and young people with special educational needs and disabilities and their parents or carers in every council area have access to information and impartial advice and support covering special educational needs and disability issues across education, health and social care, and will establish a national helpline including a dedicated free phone service and access to online information and advice and support to be available to families and carers who have children and young people with special educational needs or disabilities. It is the government's intention to have this service to be available by April 2018. In addition to this new national service, the Council ensures that it provides a range of information through the local offer and through its own special educational needs services.
Dr. Self, have you got a supplemental you would like to ask?
Yes, I have. We've heard that government funding may be forthcoming in April 2019, which is very much to be welcomed. Unfortunately, the independent support service that we have in Herefordshire is not funded from this April. How does the Council's budget ensure provision for a very vital service in the interim period?
Councillor Lester?
Thank you. Well, we have budgeted to provide for our services, as I say, that exist as they are now, and they're always in a position where we're wishing to improve those services, but those services that we provide will remain, and the government will make its decision about future funding arrangements, but our arrangements will remain, and this will be, of course, working in conjunction with what the government is proposing to come about from April 2018.
Thank you. And thank you for coming, Dr. Self, and please feel free to remain for as long as you wish. Dr. Whaley, would you like to go to the microphone? And
I think you've got my name on. It's Dr. Margie Wally. Okay. My original question was Blackmarston, Bars Court, Westfield, special schools educate profoundly disabled children with complex medical needs. 2 years ago, they had full-time nurses, clinical nurses. Now they do not. This contravenes the Children and Families Act 2014, putting the health and safety of vulnerable children at serious and daily risk. Does the 2017-18 budget expedite the Council's assumption of its proper responsibility to the education and care of these children and ensure funding for clinical nursing, school nursing?
Again, this goes to the Cabinet Member for Young People and Children's Wellbeing.
Once again, I'd like to thank Dr. Wally for the question. The support of children with clinical needs is the responsibility of Herefordshire Clinical Commissioning Group, which has commissioned a service to be delivered by the Wye Valley Trust, and I'm advised that they're now recruiting to fill the post, which will support all children with high-level needs, clinical needs across the county, but will largely be focused on the 3 special schools that are mentioned in the question. I also understand that Wye Valley Trust is undertaking a recruitment process and expects the service delivery to commence in April. With regard to school nursing, which does not provide clinical support, that is the responsibility of the council, and all of the schools concerned will also have the appropriate allocation of school nursing.
Thank you. Dr. Orley, have you got a supplemental?
I have. It's good to hear that, but bearing in mind the school's already waited 2 years and are working with the most vulnerable and challenged children in the local authority. In the last year, Black Marston alone had 11 children out of their 85 children who were looked after children as well as being profoundly learning disabled with complex medical needs. Perhaps the local authority could make some haste in taking on its responsible commissioning body role and ensuring that all agencies contribute to the education and healthcare plans and get this work in place as soon as possible.
Councillor Lester?
Just that I note the point, and I'm as keen as anyone to make sure that these posts are in place and looking after our vulnerable children.
Well, thank you very much for attending, and likewise, please feel free to stay for the rest of the meeting. Now moving on, the next question is from Mrs. Palgrave. I don't believe Mrs. Palgrave is here this morning. No? In which case I will read the question. Destination Hereford Report 2016 showed significant car use reduction after investment of £4.97 million promoting and enabling sustainable travel. Today, Council is being asked to authorise expenditure over £5.38 million in 3 years, developing designs and obtaining consent for the bypass. How does this deliver better value for money compared with investing further in sustainable travel across the whole city, including the east, where many junctions are over capacity? That's quoting Amy in 2010. Can I have the answer, please, from the Cabinet Member for Infrastructure?
Yes, thank you, Chairman, and thank you to Mrs. Palgrave for yet another interesting question. It isn't a case of either or. Extensive analysis and studies undertaken identify that a bypass, together with other improvements in the city centre, are required to meet the objectives of the project, which are to enable growth needed in Hereford and enable a healthier and safer city. Moving the A49 out of the city centre is the only way of restricting traffic in the city centre to allow for better walking and cycling facilities there. Investing only in sustainable travel and junction improvements in place of a bypass would not. The upcoming consultation will enable us to gather views on the emerging proposals and will shape the kind of measures that could be delivered with the bypass, which could include sustainable travel and junction improvements if appropriate. Thank you.
Thank you. I shall now move on to the next question from Mrs. Morawetzka. Mrs. Morawetzka. Please feel free to be seated if that's easier for you with your laptop.
That's fine. Right. From the report to Cabinet on Thursday the 18th of January 2018, it appears that Herefordshire Council has spent £2.932 million on developing routes for the Western Relief Road. How can officers incur this level of spend when the only traceable budget agreed by councillors for the Western Relief Road was just £600,000, approved by Cabinet at their meeting on the 16th of June 2016?
I'll pass that question to the Cabinet Member for Finance, Housing and Corporate Services to respond.
Thank you for the question. The June 2016 report authorised works to the value of £3.25 million. The report recognised that in the event that £2.625 million external funding was not fully secured, consideration would need to be given to allocation of further funding. External funding of £890,000 has already been secured, and there is still a live bid for further external funding, the result of which is expected later in the spring. The project was included in the approved Public Realm Annual Plan. Authorisation of environment between approved budgets is carried out in accordance with the finance procedure rules. Proposed use of reserves, if necessary, was reported to the Cabinet on the 18th of January and will be formally approved as part of our normal quarterly budgeting monitoring cycle.
Would you have a supplementary to ask?
Yes. So who exactly in Herefordshire Council authorised contracts for over £2.932 million to be spent on developing a Western Relief Road? And was the Council's procurement process followed in securing these contracts, including requesting competitive tenders for the work?
Councillor Shaw.
I'd defer to the 151 officer.
Thank you, Chairman. I think there were two parts to that question. Who authorised the contract and was the procurement process followed? The spend is a range of items that were spent. There wasn't one contract for £2.9 million. We spent on a number of areas, and the authority and the officer that was, as in the Cabinet report in June 16, where it delegated authority to do that. I will need to check with my other colleagues about procurement. I don't have that information to hand, so we'll have to provide it.
I think in the circumstances, Chair, I'd prefer to deliver a written reply to that question, given that it requires a detailed examination of Cabinet meeting.
So you'll be responding to the supplemental in writing?
I will be.
Thank you very much.
How long is it for a written response?
Would you like to give yourself a deadline, Councillor Shaw?
If I could be allowed a couple of weeks to arrange meetings with various officers to do that.
Could it be made available prior to the consultation on the Western Relief Road starting, please? Because you've set the timetable.
At the moment, we're just dealing with the question.
I believe that's
the answer will be given.
I believe that's the 6th of February. That'll be acceptable.
Okay, thank you, Councillor.
Thank you. And thank you for your question and attending this morning. Can I now move on to the question from Mrs. Morris? Is Mrs. Morris here? Thank you, and please take a seat and put your question.
Right, good morning. The capital programme shows the Hereford Transport Package costs £510,000 in 2017-18. However, the report to the Cabinet showed a total cost for 2017-18 of £2.122 million, £383,582 being taken from the Severe Weather Reserve. With recent accidents on rural roads due to wintry conditions, who decided the Severe Weather Reserve should be used for a capital project for which councillors had approved no formal budget, and when was that decision made?
Can I pass that, please, to the Cabinet Member for Finance, Housing and Corporate Services?
Thank you, Mrs. Morris, for your question. Use of the reserve has not yet been authorised, but it was identified in the 18th of January Cabinet report as a potential source of funding should the live external funding bid prove unsuccessful. Approval of environment between the approved budgets is carried out in accordance with finance procedure rules. Proposed use of reserves was reported to Cabinet on 18th of January and will be formally approved as part of our normal quarterly budget monitoring cycle. This will not impact on our ability to maintain gritting of our roads during severe weather, the cost of which is supported from the base budget rather than reserves which are intended only to cover very exceptional circumstances.
Mrs. Morris, do you wish to put a supplemental question?
I do, but on that question I did ask who, and I got the when, but I didn't get the who. But anyway, yeah, I do have a supplementary. The budget consultation report shows that when asked about capital investment, 77% of respondents wanted investment in road maintenance, and 50% wanted supporting stroke facilities for young people. Only 47% wanted investment in new roads. How does the proposal of an additional capital budget of over 2.45 million for yet another new road for Hereford, with no proven benefit, respect the priorities of the electorate, particularly their preference for investment in road maintenance?
Councillor Shaw.
Well, I acknowledge the results of the consultation, which clearly identified improvements in road maintenance as a priority measure by those who responded to the consultation. I'm pleased to say that the majority of the capital funding that's been in the reserves following the litigation taken against Amy has been released in next year's capital project, and I think that sum is an additional additional 5.5 million of combined capital and revenue spend, which will be used on the roads in our county.
Thank you very much, Mrs. Morris, and again, you're very welcome to stay for the rest of the meeting. The next item is from Ms. Sharp. I don't believe she's here this morning. If not, I'll read the question. The Council's July 2017 quarterly monitoring report to the Department of Transport shows a very different capital spending profile on the South Wye transport package to that included in the Herefordshire Council agenda for today under Capital Project Appendix 3. Would the Cabinet member responsible please explain which figures are correct and why there is such a difference between the reports? Councillor Shaw.
Thank you, Chairman. I thank Ms. Sharp for her question. Unfortunately, the figures quoted by the questioner are not correct summaries of either Appendix 3 to the Capital Programme report or the quarterly monitoring report. In Appendix 3, the total figure is 35 million. It would appear that the questioner has inadvertently omitted to take account of the negative figure of £629,000 shown in brackets in the brought forward column. The quarterly management report figure for 2020-21 states 6,855,000, giving a total figure of 35 million. It's clear that the profiling of spend has changed between the production of the two reports, but this is profiling of a budget, and this will continue to change as the programme progresses, and is nothing unusual.
Thank you. The next question is from Ms. Coda, who I believe is not in attendance today. The question reads, with the likely closure of Red Hill Rehabilitation Centre in the coming month, what provisions and what financial arrangements have been set in place and planned for the future to support the additional workload from patients who are more likely to be discharged directly to home? These will include some very vulnerable people needing to recover from serious injuries and re-enable, despite often being very elderly and frail. I pass this question to the Cabinet Member for Health and Wellbeing to respond.
Thank you, Chair. The Council are working closely with health partners to support the move to enable more people to go home once they are medically fit following hospital treatment rather than stay in a hospital bed. The impact of delaying the move home greatly impacts on the person's ability to recover and regain confidence in key skills. However, Herefordshire will still have a large number of community beds, and if someone has needs that are best met in one of these beds, they will be transferred to one. Thank you.
Thank you for that. The next is from Mr. Chapman. Is Mr. Chapman here? Thank you. Please take a seat.
Thank you. Good morning. The success of a new road, whatever we title a new road, must be predicated on reducing car use and congestion. It is intended to build a vast housing development and the resulting surgeries, schools and shopping centres. An obvious consequence is increased congestion in the city. especially in the east, which is, I believe, is already at overcapacity. How much property taxpayers' money is identified to build the required new schools, health facilities, industrial estates and associated sustainable infrastructure?
I'll pass this to the Cabinet Member for Infrastructure.
Thank you, Mr. Chapman, for your question. The success of a bypass is not predicated solely on reducing car use and congestion. The delivery of the bypass as part of a package of measures will enable the growth of Hereford, as we set out in our core strategy plan. New homes and new jobs at an expanded enterprise zone will help secure our future by retaining our young people and attracting new families to the city. The new university could transform this city. This growth cannot be delivered without new infrastructure. The new road will provide an alternative to a congested trunk road which goes right through the heart of the city, impacting on homes, businesses and schools, improving safety and air quality for these people. The infrastructure for growth will not be delivered exclusively by the council, but also by developers, home builders and industry and central government departments, using a variety of funding streams. The council's own investment plans and how these will be sourced are included in the capital programme and medium-term financial strategy. Thank you.
Mr. Chapman, do you have a supplemental?
Yes, please, yes. To paraphrase the councillor then, this is therefore not a bypass, but merely increased infrastructure to the road system. As a prime user, living a mile or two to the west of the proposed bypass route, I suppose I would be a prime user of such a bypass. But looking at all my journeys last year, I think I would have used this new road something like 4 times. I do see that I will join larger queues of traffic entering the city once the new housing is built, assuming I can navigate and find where the road is from the potholes that I'm currently circumnavigating. Please, can you explain how the council expects to improve general transport infrastructure? For instance, I don't have the confidence of that, because, say, in communications, the infrastructure is a disaster. What work, for instance, has the council done to give the population who live only 4 miles from the city an internet speed of greater than 0.8 megabits?
Councillor Price.
I'm sorry, Chairman, but I'm not 100% certain what bit of that is that it requires an answer. It's his own personal view of his travel arrangements around or into and out of the city, crossed with a number of issues about road maintenance issues. I will just refer to the fact that this bypass and the second bridge crossing over the River Wye is absolutely imperative to be able to allow Hereford to survive going forward. The fact that we are here discussing a budget is actually determined by the ability of future growth of this city. You know, the services that we are talking about today have to be met with a cost, and without growth in this city, at some point in the very near future, we will not be able to achieve the arrangements that have to be in place. The bypass, and I think this is a reference to the bypass itself, is absolutely key to that future growth. The rest of the questions, well, maybe if Mr. Sharp would like to have a conversation with me, it's more of a sit down over a pint, I suspect, to have a debate about his particular issues rather than a specific answer to a question here at Council. Thank you.
Thank you very much, Mr. Chapman.
You can't answer the question.
If I can now move on to the next item, which is questions from members of the Council. And the first one is from Councillor Chappell.
With the closure of Hillside and the expectation that patients will be discharged from hospital to their homes, Will the Cabinet member review the contracts in place with private home care providers to ensure they have enough staff, can provide enough hours of care, have the resources to care for clients in their homes, whilst allowing the council to secure contract efficiencies in line with savings proposals in the budget?
Councillor Rowan.
Well, the answer I can give is very similar to the one that I gave to the public question from Miss Coder. I can understand Councillor Chappell's concerns about this facility and the building, because it was built while he was the councillor for the ward. But I just refer you to the response that I gave to the public question, if that's all right, Councillor Chappell.
Councillor Chappell, supplemental?
Chairman, I thank the councillor for that. There is a shortage of full-time care workers in Herefordshire, and the council has half-hourly care packages with private home care providers, which causes huge logistical problems in rural areas. There are several examples, for example, where a client has fallen on the floor and the care worker goes in, wraps them up, dials 999, and then is asked by their private employer to move on and leave the client on the floor where they are. And as we know, in Herefordshire, ambulances can take an hour or so to reach the patient. The answer that the Cabinet member has just given, therefore, is simply not good enough.
Could I have the question?
I am getting there, Chairman, but you need to have it. With more people being discharged from hospital directly to home, there is a likelihood, a probability that half-hour programmes of care will not be sufficient, and therefore the council needs to review that as a matter of some urgency. Will the Cabinet member give that assurance that no client in receipt of home care package with Herefordshire Council be put at risk as a result of these contracts?
Councillor Rowan.
It's our intention in civilised society to make sure that happens. However, what we all have to bear in mind, and I've been asked this question many times, is that even though the building itself belongs to this authority, the services from there are not controlled by this authority. They are in the NHS. So therefore, and if any interested parties had been able to attend scrutiny yesterday morning at 10 o'clock, there was a good discussion for an hour which pointed that out, and also quite smartly put in place the services for care. But what it all boils down to is somebody who is in need of care when they've left hospital recovers much better at home than they do in a facility. Thank you.
So you couldn't or wouldn't answer the question.
The next question is in the hands of Councillor Crockett.
Thank you, Chairman. Will the Cabinet member please assure members that city centre sites and others which the administrators of the proposed university show an interest in purchasing will be disposed of in accordance with the Treasury Management Strategy to be approved at this meeting and advertised for sale on the open market, ensuring that taxpayers of this county obtain full value for money, which is the duty of any public body?
Councillor Shaw.
Thank you, Councillor Crockett, for your question. This isn't, however, a matter related to Treasury Management Strategy. The Council has a duty to secure best value, and any decision to dispose of council-owned land will be carried out in accordance with the Council's corporate property strategy. That strategy sets out that the Council may dispose of land at less than full market value, where it considers that the purpose for which the land is to be disposed of is likely to contribute to the promotion or improvement of the economic, social or environmental well-being of the community.
Councillor Crockett, do you want to come back with a supplemental? Right, thank you.
I don't have one.
Councillor Powers.
Thank you, Chairman. Can I just start by saying that this process of public and member questions having to be submitted in advance and no written answers being provided ahead of this meeting makes it very difficult for anybody to ask necessarily relevant or coherent supplementary questions to the answer just provided at this meeting. We know full well that cabinet members...
Councillor Powers, this would be a matter for audit and governance with them addressing the review of the Constitution, and I suggest you put those views to them. At the moment, I am only prepared to take questions. Would you care to put your question, please?
In early 2017, Department for Communities and Local Government provided £503,000 from its Community Housing Fund for Herefordshire Council, quote, to build capacity within local groups and set up support hubs, unquote. This was approved by Cabinet on 9th of March 2017. What applications have been received, from whom and to what sum, of which how much has been approved, is pending or been dispersed, what remains in the fund, and where is this shown in the budget?
Can I pass that again to Councillor Shaw, please?
Thank you, Councillor Powers, for your question. In accordance with the decision taken by Cabinet on the 9th of March 2017, to date, £195,000 of the £503,000 allocation has been awarded to support 5 projects. I can provide, if requested, a detailed response, but these include a community self-build project for veterans in Leominster, a hostel extension in Hereford, and parish council projects in Glanwarn and Fownhope. A further £110,000 has been allocated to support training, housing needs analysis, and delivery capacity. Applications are currently under consideration, which, if approved, would account for up to a further £126,000, and it is anticipated that the remaining £73,000 will be allocated in accordance with the scheme criteria before the end of the current financial year. The government has announced that the fund will continue for a further 3 years, but will be administered by Homes England and not by councils, and therefore future provision is not reflected in the proposed budget.
Do you have a supplemental?
I do. Thank you. Thank you, Councillor Shaw, for that detailed answer. Can you please state categorically that all monies already granted or yet to be granted from the Community Housing Fund meet the criteria set out and approved by Cabinet on 9th of March 2017?
Certainly, it is my understanding that all the schemes hereby approved have been approved according to those requirements, and I'm very willing to meet with the councillor to review any scheme in which he has a particular interest.
Thank you very much. I will take you up on that offer. Thank you, Councillor Shaw.
Councillor Ginman, would you like to put your question?
Thank you. Mindful of the 4.1 million rural grant from government and the reimbursement from a previous council contractor, what is the message to the road users and council taxpayers as to the spend for this coming year on rural road repair, reconstruction and preventive maintenance? And how does that match any survey estimates of need given the deteriorating state of the roads in most of the rural areas of the county?
And I'll pass that to the Cabinet Member for Transport and Regulatory Services, Councillor Durkin.
Thank you, Chairman. Thank you, Councillor Jimmy, for an interesting question. The message to the taxpayers is that we are using the resources available to us in the most cost-effective way to improve and sustain the overall condition of our roads. The condition survey shows that we have improved the overall condition of Herefordshire roads as a result of the substantial investment made in recent years. There is more work to do, and today's report on the capital programme considers the investment of a further £5.6 million into our roads and bridges throughout the county in the coming year. Herefordshire has the second highest mileage of roads per head of population in England, and we continue to pursue every funding opportunity available to us to improve the condition of our 2,000 miles of road by investing in road servicing works and bridge repairs that will reduce longer term maintenance costs. Thank you.
Do you have a supplemental?
Thank you. It's partly observation. As a person in...
It should really be a question.
It will
if
be.
you can...
Don't worry, I'll get there.
Thank you.
As a person who's has travelled the county roads as part of his profession for many years, and indeed by a vox pop of talking to postal workers and delivery, what is the norm, the standard to which you are now referring when you're saying that indeed matters have improved? Because by any judgment that I've done, by any survey and personal observation, the norm has moved to a very poor standard, and therefore the improvement from that is not one that is measurable and acceptable. It is time to go back to the standard that we expected 10 years ago, not one that we seem to have now accepted as the norm.
Mr. Durkin.
What was the question? I'm sorry, Captain.
What is the standard to which you refer? Because you say that there has been the investment and that you have made improvements. That demands that there is a standard set in the first place from which you can measure improvement. I'm suggesting that that standard itself is not in the right position and indeed is an acceptance of an unacceptable standard, and it needs reviewing.
Thank you, Chairman. Thank you, Councillor Jim. I think this is something that requires a written answer, Chairman, because it's a technical nature, and I think I need to give the correct answer with this second question.
So the same, you're happy to give a written answer within the next 14 days?
Yes.
Thank you very much.
So can I just inquire, when there are written answers, and there was a previous one a moment ago, does that mean all council get sight of that?
It should be circulated to all councillors.
Thank you.
Yes.
But not at the time it's circulated to the Cabinet members.
The next question is in the hands of Councillor Michael.
Thank you. Why are tenants of the council's land holdings on the Rotherham estate not being offered the opportunity to buy their own freehold before the land is sold by auction in London? Is this consistent with the Treasury management strategy and asset disposal policies at the council?
Can I pass that again to Councillor Shaw?
Thank you, Councillor Michael. Again, this is not a matter related to Treasury management strategy, and I'll expand that a little bit because these land holdings are held as part of the economic development strategy and not as investments for Treasury. But as a report informing the decision to dispose of the freehold ground leases on this site set out, disposals are undertaken in accordance with the Council's corporate property strategy. The Council has a duty to secure best value. This is being achieved through open market disposals, which ensure that tenants have an opportunity to bid. And I understand in recent disposals, tenants of 2 of 3 properties bought their own freeholds.
Do you have a supplemental?
I do. Whoever's remit it does come under, can we have assurances that all the tenants will be informed at the earliest opportunity, please?
Councillor Shaw?
I would defer to Cabinet colleagues, but I would expect all tenants to be informed of any prospective sale, and I'm interested in any evidence that the councillor might have that this hasn't been the case in the past.
Councillor Harlow, do you want to add to that response?
Yes, certainly. It's my understanding that Property Services have been telling all tenants when their freeholds go into auction. We certainly asked if that's the case. Most of the purchasers have indeed been local, so I'm not quite sure if this thing has been stolen in a teacup.
Right, thank you. And that brings to an end the public and members' questions, and I'd like to thank everyone for taking part, especially the members of the public for putting their questions and staying for the answers.